Hello, everybody. Welcome to our presentation on Bell's palsy. My name is Marina Souden, and my group members were Jenna McCafferty, Simone Dukes, and Taryn Chambry. Let's get started. So, what is the history of Bell's palsy? This disease is a neurological disorder named after the surgeon, Sir Charles Bell. Sir Charles is considered to be the first to discover Bell's palsy, also known as the idiopathic facial paralysis. Even though Sir Charles Bell is known to be the first to discover Bell's palsy, the earliest recording of this disease ranges back to the year of 1683. Bell's palsy accounts for 60 to 70% of unilateral facial paralysis. The pathophysiology of Bell's palsy is idiopathic, meaning that the spontaneous inflammation of the facial nerve plus the activation of unilateral facial paralysis is unknown. Although viral infection or autoimmune diseases such as herpes and Guillain-Barré syndrome has a history of causing the onset of Bell's palsy. Moving forward, for client education, the nurse would want to educate the patient on morning, night, and daily care. For morning care, the nurse should educate the patient about the importance of using wraparound sunglasses or goggles to decrease the evaporation from the eye. Nighttime care includes teaching the patient how to close their eye manually. First, the nurse should encourage the patient to wash their hands for at least 20 seconds. Then, gently use the pads of their middle and pointer finger, slowly bringing down the eyelid to meet the lower lid. Other client education pertains to verbal and physical demonstration of facial exercises such as wrinkling the forehead, puffing the cheeks, and whistling. The nurse should also educate the patient on how they should expect their recovery process to be. Usually, recovery is 3 to 5 weeks after onset of the signs and symptoms. To promote smooth healing, advise the client to avoid extreme temperatures and drafts. Expected findings include a rapid onset of mild weakness to total paralysis on one side of your face. This can occur within hours to days. Next, we have drooling. Then we have difficulty making facial expressions, also facial drooping. Then we have pain, specifically inside or behind the ear on the affected side, and also in the jaw. Then we have increased sensitivity to sound, headaches, loss of taste, and a decreased amount of tears and saliva. Although a mild case of Bell's palsy can go away within a few weeks, there are some cases that have more severe complications. There's a case that when the patient smiled, it could cause the eye to close on the affected side permanently. Another case was excessive dryness in the eye, causing the scratching of the cornea, which potentially led to partial or complete blindness. There was another case of possible irreversible damage to the facial nerve, regrowth of nerve fibers that may become irregular, which can lead to involuntary muscle contractions, partial or complete blindness again to the eye on the affected side of the face. Some risk factors are age. The most common age groups affected are ages between 15 and 45. Another risk factor is preeclampsia. Then we have pregnancy, obesity, hypertension, diabetes, and upper respiratory ailments. So, nursing care should involve maintaining a soft and nutritional diet with foods that are easily chewed, swallowed, and digested. Frequent mouth care helps to prevent buildup between cheeks and the gums. Also, to improve sleep quality, the nurse should apply eye ointment to ensure the patient's eyelids remain closed during their sleep. Moving forward, for safety considerations, the client will be experiencing the inability to control their lower extremities, limited range of motion, and muscle spasm. So, the nurse must assess the client's developmental milestones towards standing, walking, all with assistance from the nurse. The client will be experiencing difficulty chewing, swallowing, and sucking. Therefore, they should be NPO. This impacts caloric intake and causes the client to be underweight. So, offer small, frequent meals that are soft and blended in high in protein fiber. And then, of course, most essentially, position the client upright during the feedings. Moving on, the client will be experiencing difficulty vocalizing words, discerning, and maintaining a usual communication pattern. So make sure there's multiple means of communication and ample time for the client to respond. So whether that involves getting the client a pad and a pen, or even a whiteboard or some flashcards so they can communicate back and forth with you as effectively as they can. Then finally, assess the level of consciousness of the patient, provide a safe environment with seizure precautions, and keep the padded side rails up in the bed and keep the bed in the lowest position possible. Next are medications and alternative medicine. First, we have corticosteroids. These are used to reduce the swelling of the facial nerve. Then added to the steroids would be antivirals. This may be beneficial for Bell's palsy, but has not been proven for everyone. Acupuncture is another form of alternative medicine. This helps stimulate your muscles and nerves for some relief for the patient. Then we have biofeedback training that can help the patient control their muscles better. Then we have this toxin that is used to help promote the symmetry of the patient's face and can also relieve symptoms of those muscle spasms that the client is experiencing. Moving forward, we have therapeutic procedures for medication administration. Again, we're going to go in with that corticosteroid, specifically prednisone. This treats acute and chronic inflammatory and immunosuppressive disorders. Some adverse effects and reactions of this corticosteroid are seizures, heart failure, adrenal insufficiency, GI bleeding, pancreatitis, hypernatremia, and hypokalemia. Another therapeutic procedure would definitely be physical therapy. Here, the patient will learn how to massage and exercise their facial muscles to prevent shrinking and shortening. Then, although surgery is no longer recommended as a therapeutic procedure, there is a form of decompression surgery that was performed to relieve pressure on the facial nerve that opens the bony passage that the nerve passes through. Next, we have health promotion. So the nurse would want to teach the client to perform facial muscle exercises, wearing an eye patch at night to prevent any scratches, lubrication of the eye, eating on the unaffected side of the mouth, seeing an eye doctor as scheduled, and also seeing a dentist regularly. Then for diagnostic procedures, there's no specific laboratory test to diagnose this disease, but the healthcare provider will most likely assess the client's face and the movement of their facial muscles by having them close their eyes, lifting their eyebrows, smiling, and frowning. Continuing with some more laboratory tests, we would go in with an MRI or a CT scan to rule out any possible tumors or skull fractures because these would be sources of pressure on the facial nerves. We could also get a EMG and confirm nerve damage and the severity of that nerve damage. No blood test could be used to rule out any problems, but they can rule out any infections. And here we are on the NCLEX question slide. So I have two very short videos that one is a select all that apply and one is just a multiple choice answer. I'm going to play for you guys and I want to see if you guys have been paying attention. And let's go ahead and play the first one.
Question number 1. Which of the following nursing interventions are appropriate for a client diagnosed with Bell's palsy? Select all that apply. A. Encourage the client to do facial exercise such as wrinkling of the forehead. B. Remind to never blow out the cheeks, just like when performing a whistle. C. Eye ointment should be applied at daytime but not recommended before going to bed. D. Encourage to use an eye shield specifically when going out. E. Apply local heat opposite to the affected side. Or F. Teach the client how to manually close the eyes before going to sleep. With select all that apply questions, you have to carefully analyze the answer options one by one. In option A, encourage the client to do facial exercises such as wrinkling of the forehead. You should instruct your client to do this because this may reduce the risk of further damage. In option B, remind never to blow out the cheeks, just like when performing a whistle. This is a valid exercise which you actually should teach your patient. Therefore, this answer option is not correct. In option C, eye ointment should be applied at daytime but not recommended before going to bed. Applying eye ointment will promote adherence of the eyelid and thus prevent injury. This is an intervention that will protect the eyes at night. During the day, regular eye drops are recommended, making this answer option wrong. In option D, encouraged to use an eye shield, especially when going out. This is also an intervention that would protect the eye and prevent injury. So this answer option would be correct. In option E, apply local heat opposite to the affected side. This can be therapeutic and also help with sore muscles. And finally, option F, teach the client how to manually close the eyes before going to sleep. This is correct because it will help prevent injury to the eye, making the final incorrect answer options A, D, and F, because all of these interventions will help with Bell's palsy. Heat should be applied to the affected side, making this answer option not correct.
So just to recap the correct answers for A, D, and E. On to the next video.
Question number 3. A client admitted is suspected of having Bell's palsy. Which of the following signs and symptoms would the nurse expect to note in the client? A. A tingling sensation of the eyelids. B. Burning pain in the nose with intermittent facial paralysis. C. Speech or chewing difficulties accompanied by facial droop. Or D. A stabbing facial pain with intermittent tingling sensation in the eyes. Looking at these answer options, option A, tingling sensation of the eyelids. A tingling sensation is not a characteristic sign or symptom in patients with Bell's palsy. In option B, a burning pain in the nose with intermittent facial paralysis. This is also not a sign of Bell's palsy. In option C, speech or chewing difficulties accompanied by facial droop. Bell's palsy is a one-sided, in most cases, facial paralysis from compression of the cranial nerve 7. There is a facial droop from paralysis of the facial muscles, increased lacrimation, speech and chewing difficulties, and painful sensations of the eyes, in the face, or behind the ear, making this answer option correct. In option D, stabbing facial pain with intermittent tingling sensations in the eyes, Bell's palsy is usually not associated with pain, especially not in the eyes. So again, the correct and final answer option here would be C.
All right, so the correct answer was C. That concludes our presentation on Bell's palsy. Thank you for watching and listening. The next slides are our references. And have a great rest of your semester.